My name is Hadjizacharia. My patients and colleagues refer to me as Dr. Pan, and I'm a vascular surgeon at Boulder Community Health. As a vascular surgeon, I provide care for the blood vessels of the body, which is arteries and veins, excluding the arteries and veins of the brain and the heart. Patient care philosophy that I follow is respecting the autonomy of a patient, involving them in the decision-making, whether it's endovascular or an open approach and the hybrid approach of both open and endovascular, directing that particular therapy for a particular patient and having them involved in that decision-making. I think it creates a better outcome for patients. The type of minimally invasive endovascular approaches that we have, it's doing a stent or balloon of the carotids. For an abdominal aortic aneurysm, it's placing a stent graft and having a minimal approach just going through the groin. That approach is also performed percutaneously. The other approaches for lower extremity arterial disease, again, is percutaneous, endovascular, doing ballooning and stenting to improve blood flow down the limbs. My favorite part about patient care is in vascular surgery, management of the patient is lifelong. Majority of surgical practices, once they operate on a patient, like general surgery, taking out an appendix, they'll see the patient post-op and never see them again. Our patients is a lifelong commitment. You develop this relationship and you're their surgeon for the rest of their lives or your life. And I think that relationship is key. You operate on their carotid artery, you reduce their risk of stroke, and your follow-up is lifelong. You place an aortic stent graft for an abdominal aortic aneurysm. Again, it's a lifelong, relationship. Doing a bypass in the low extremity or improving the blood flow to reduce the risk of limb loss. Again, it's you pretty much have that relationship with that patient, managing or their pathology. I think this lifelong relationship is what attracted me to vascular surgery.